So testosterone replacement for women, does it make sense? Is it reasonable? Are there problems? Are there side effects that women need to worry about? I'll answer that really briefly. So testosterone replacement therapy has become more popular for women in recent years, and there's been more interest in it. And I've heard a lot of different discussion, including people being very afraid of it and concerned about it, that there'd be negative side effects or things like that. And nothing is guaranteed to be side effect free. There can always be the issues. However, if a woman needs it, it seems to be very beneficial. In fact, of all the hormones to replace, it might be the most beneficial when you compare it against estrogen and progesterone. Usually, testosterone monotherapy is far more useful to relieve symptoms of, premenopause, perimenopause, and postmenopause women. All you need is testosterone in most cases for them to feel well, and mucking around with taking estradiol and progesterone pills honestly usually doesn't do much particular good. So it seems to be very beneficial, but what does the clinical evidence say? Clinical evidence says that it's a reduction in all cancers, but especially breast and uterus cancers. It also seems to help metabolic health and insulin sensitivity and things like that. It also obviously will help a woman's sense of well-being. It also will counteract bone mineral loss. It also will counteract loss of muscle mass to some degree, and also mean that any training you do will elicit a greater response. It also will help counteract anemia, so long as your iron intake is sufficient. These are all things that are specific to women that become a certain age, and the risk goes up very significantly. It even seems to mitigate certain cardiovascular diseases and dementia as well, or any kind of cognitive decline. And so these are all wins with specifically reducing the risk towards certain disease states that are most often affecting older women. So it seems like anything, it's good all around. Now, there can be terrible protocols that doctors use and other things that don't make sense because the devil can be in the details. But in general, competently managed testosterone replacement therapy is particularly beneficial for women, and particularly beneficial for women who are going through or about to go through menopause or have gone through menopause already, from a health and well-being point of view. If you guys have any questions or anything, I'd be happy to help you guys with this. I don't treat women as a doctor or anything like that, but I have helped many women navigate these waters. So reach out and talk to you guys later.